Pleural fluid comes from the thoracic cavity around the lungs. Normally, it is clear and pale yellow. If the fluid is turbid, it suggests the presence of white cells or bacteria. Bloody pleural fluid is often due to trauma or malignancy, while a milky appearance indicates chylous fluid. Laboratory findings include increased red cells with trauma or malignancy, increased neutrophils with bacterial infections, and increased lymphocytes with tuberculosis or malignancy. Glucose levels may be decreased in tuberculosis, rheumatoid inflammation, or malignancy. A low pH can be seen in tuberculosis, malignancy, or esophageal rupture. Elevated amylase suggests pancreatitis, while elevated carcinoembryonic antigen indicates malignancy. Pericardial fluid is located around the heart. When turbid, it may indicate infection or malignancy. Bloody pericardial fluid can be due to tuberculosis, tumors, or trauma from cardiac puncture. A milky appearance is associated with lymphatic drainage. Laboratory findings include elevated red cells with tuberculosis, tumors, trauma, or cardiac puncture. Increased neutrophils may suggest bacterial endocarditis. Decreased glucose is associated with bacterial infection, and elevated carcinoembryonic antigen points to malignancy. Peritoneal fluid surrounds the abdominal cavity. Turbid fluid suggests peritonitis or cirrhosis. Bloody fluid suggests trauma. Milky fluid suggests chylous effusion, and green fluid indicates the presence of bile. Laboratory findings include increased red cells with trauma and increased neutrophils with peritonitis. Glucose is decreased in tuberculosis, peritonitis, or malignancy. Amylase is elevated in pancreatitis or gastrointestinal perforation. Elevated alkaline phosphatase indicates intestinal perforation, while increased urea or creatinine suggests a ruptured bladder. Sweat fluid comes from the sweat glands of the skin. Normally, it is clear and colorless. The key test performed is the sweat chloride test. An increased level of sodium chloride in sweat is diagnostic of cystic fibrosis. Synovial fluid surrounds the joints. Under normal conditions, it is clear, pale yellow, and viscous. Abnormal appearances include bloody fluid in hemorrhagic arthritis, milky fluid with crystals or cells, green fluid with bacterial infection, and deep yellow fluid in inflammation. Laboratory testing includes cell counts, where increased red cells indicate hemorrhage. More than 25% neutrophils suggest sepsis, and increased lymphocytes point to non-septic inflammation. The presence of uric acid crystals, also called monosodium urate, indicates gout. Gastric fluid is secreted in the stomach, composed of hydrochloric acid and pepsin. Its appearance depends largely on diet. Testing focuses on titratable acidity. A decrease in acidity occurs in pernicious anemia due to lack of intrinsic factor, while an increase is seen in duodenal ulcer or Zollinger-Ellison syndrome. Amniotic fluid surrounds the developing fetus within the amniotic sac. Normally, it is clear and colorless. If it appears yellow-green, it suggests bilirubin from red cell destruction. Laboratory tests provide important insights. Bilirubin levels decrease in hemolytic disease of the newborn, indicating red cell destruction. The lecithin to sphingomyelin ratio of 2 or greater signifies fetal lung maturity. The presence of phosphatidylglycerol also confirms fetal maturity. Creatinine concentration is used to estimate fetal age. Elevated alpha-fetoprotein levels indicate neural tube disorders such as spina bifida,